Hey, I'm Dr. Joffrey. In this video, we will be discussing hemorrhagic strokes. We will be discussing hemorrhagic strokes in less than 5 minutes. A hemorrhagic stroke is basically when you have a blood vessel rupture in your brain. There are two different types. There's an intracerebral stroke, which means the blood vessel ruptures within the brain tissue. And then there's a subarachnoid hemorrhagic stroke. And that's when the blood vessel ruptures between the lining of the brain and the skull. Now, both these conditions are extremely dangerous. They cause increased amounts of pressure on the brain, and that pressure can damage cells. This is a true medical emergency. Some of the most common signs are, boom, a severe crushing headache, sudden dizziness, sudden nausea, some sudden vomiting. It's one of those that you know that's something the matter. Most of my patients and most patients come in and say it's the worst headache of their life. They usually cannot open their eyes. They're really dizzy. They're ataxic, which means that they cannot walk straight. This is a medical emergency. The risk factors are high blood pressure, a family history of hemorrhagic strokes in the past, smoking, hypertension, especially uncontrolled hypertension, and then there's something called AVM. Those are AV malformations. That means that your arteries are malformed. There's no way of you knowing that in advance unless you have a family history. Other risk factors for this are cocaine use or methamphetamine use. Yes, why? Because those substances are known to rapidly elevate your blood pressure and cause those vessels to rupture. Again, this is a medical emergency. And then some other risk factors that also include are patients who are on blood thinners for different reasons. Because being on a blood thinner puts you at increased risk for a rupture. Now, the treatment for this is one, control the pressure in the brain. There are many different ways that we do this. One way is managing the blood pressure, bringing it to a certain level so that the perfusion pressure on the brain is not as great. If the subarachnoid or if the hemorrhagic stroke was caused by you being on blood thinner, reverse those blood thinners. If it were caused by your blood pressure being so high, bringing your blood pressure down, not to its normal level, but just bringing it down. And at times, surgery is required. When in doubt, it is extremely important. Sudden crushing headache, go to the ER right away. A hemorrhagic stroke, again, it's a rupture of the brain, which is different. It's a rupture of the blood vessel in the brain. And these are less common than ischemic strokes, but they're more severe than ischemic strokes. And just to remind you, an ischemic stroke is when you have a blockage of a blood vessel in the brain and it causes part of the tissue not to be perfused well, not to receive blood, and brain tissue, it dies fast. And so that is an ischemic stroke. While that's more common, and hemorrhagic stroke is usually more fatal. Again, it's usually more fatal. Just to remind you, the classic signs of a hemorrhagic stroke are boom, a sudden crushing headache, nausea, vomiting, dizziness, unable to walk straight. Risk factors are smoking, high blood pressure, family history, cocaine, methamphetamine use, being on blood thinners, an AV malformation, and an aneurysm. And yes, it's unlikely that you know that you had an aneurysm unless you had a reason to have an MRI in the past or you have a family history. But either way, the goal is to make sure you identify when you or a family member is having an hemorrhagic stroke and getting them to the ER right away. And let me say again, to the ER and not to an urgent care. It's Dr. Joffrey. If you found this video helpful, be sure to subscribe, leave a comment. Talk to you soon.